That was not what wanted to happen. Um,
Just letting you know, it does say meeting up to 40 minutes on here.
it does say meeting up. Okay. Well,
Is that
I'm not 100% sure what's happening because we're under our CDHS account, which has full time. So why it's giving us this 40-minute limit all of a sudden, that is going to be addressed and this will not happen again. So my sincere apologies for that, everyone. I am not 100% sure what's going on there.
It's my fault. It's because I'm present. You know me and the machines. I'm radiating it out. I'm so sorry.
Not a problem.
We'll get it sorted, everyone.
Technology is great when it works, right? All right. All right. Well, that was fun. Anyways, let's back to SAMHSA. It looks like Anne got kicked off, but I'm sure she will just be joining back in.
The recording's going again, right? Yeah. I just want to make sure we can go back in minutes and all. Okay, because this time I didn't get notice that it was, and previously I got notice like 6 times, so I don't know what it's doing.
I am not sure either, but all right, we'll just keep it moving, and if it happens again, just log back on, guys. This will not be an issue in the future. I promise you that. I'm not sure.
Caitlin, I just messaged you too that if you don't have a license or if Donda
I'm under the CDHS account, so I don't know why it's doing that. We have the full account up. So
it says that the time limit is 40 minutes. So I think maybe we should just be mindful. Every 40 minutes it might kick us off.
Yep. So happens again, just log back in and we'll figure out what's going on with that because it should not be happening. Under my personal account it would, but CDHS should not. So I'm not sure. But anyways, for the sake of time, we'll keep that moving and move over to SAMHSA. So as you all know, we have our informal walkthrough on the 24th with SAMHSA, our regional SAMHSA point of contact is going to be coming, and we're just going to do, a little presentation about BHA, the state of Colorado. And so I had sent out that feedback form to you all during, I believe, the last 2 meetings. So I can send that out again if anybody, we didn't get a lot of feedback from that. So just wanted to kind of bring that up one more time during the meeting to see if there were any formal questions or comments, concerns that you would like included during the presentation. And then next year, it looks like when they come for their formal walkthrough, they'll want to join in on a meeting and we'll be able to, have a lot more one-on-one interaction with them in person. So I just kind of wanted to hold a little bit of space in case there was any last minute questions, comments, concerns that you would like included in the presentation this time around.
Did you receive our questions via the feedback form, Caitlin?
Yes, but again, there wasn't terribly much engagement. I only had 2 responses. And so I'd send out the form and I've sent out a couple of email reminders. But again, just kind of wanted to hold a little bit of space since we really didn't get a lot of engagement on the form for any last minute during the group here.
Yes, I have one.
Sure.
So hi, Anne. Thank you so much for joining us today. And thank you for our patience with our technology challenges. My question to you is, I'm on the subcommittee that's reviewing the grant application, and I think there was kind of a collective question around why is our state not currently utilizing the mental health portion of the block grant dollars towards prevention. So what we see currently is that we're spending $0 on prevention. And there was a question around why the specific diagnoses had to be in place for the mental health block grant. And that would be SMI, serious mental illness, and SED, serious emotional disorder. And also my dog might have both of those diagnoses because he's a little out there. But what I wonder is, would we be able to use these block grant dollars towards prevention of those two specific diagnoses, right? So can we allocate some of those block grant dollars based on the SAMHSA regulations to prevent people from having those diagnoses, perhaps? Or does SAMHSA allow for other diagnoses? I think that in our state, we could really utilize those dollars in prevention to save our state money and lives. And so, can you just explain a little bit why those are the two diagnoses in place and why you must have those diagnoses in order to receive mental health block grant dollars? Thank you.
All right. Well, first of all, let me say that I am not from SAMHSA. So I'm a technical assistance provider engaged by SAMHSA to help. The second thing that I would say is that serious mental illness and serious emotional disturbances are required, I believe, by the statute. Although I would have to check that to be positive, but it is, it's not changeable, right? So it's not, and that actually helps, I think, states focus on people who have a great deal of need. And there's a lot of specifications in the block grant allocation about what you have to spend money on and not on. And I honestly, let me research the prevention question. I don't know it off the top of my head.
Thank you, Anne. I appreciate that. And I'd love to see that that specific statute as you research that, just so that we can really refer to the specific statutory guidelines as we're looking at ways to make sure that these block grant dollars get out into the community in ways that we can really help those humans that need that help in our state. Looks like Dennis has his hand raised.
I was going to say, absolutely. I will research and get the exact specific statute for you. I will say one of the things that you'll find when you talk to your SAMHSA administrator on July 24th is that SAMHSA leaves many important questions up to the discretion of the state. So, but I will research the prevention question and find you the statute citation for the SMI-SED.
Thank you.
Part of our discussion in the mini grant subcommittee, actually, that was my my wish, and that is to add a clarifying word. Prevention has such a general, overwhelming connotation of substance abuse in a lot of people's views. The behavioral health, including mental health, if we had a word such as intervention and prevention and intervention, that, and maybe not necessarily that word, but that the intervention to me would be much more inclusive of the mental health component.
I will take a look at all of the language around prevention. I mean, I know that SAMHSA requires first episode psychosis programs. Those are not prevention of the serious mental illness, but they are prevention of the long-term, sometimes catastrophic effects. And so let me just look at the language around prevention and get back to you.
And everybody, I just wanted to let you know that I dropped the link to the proposal for our TA into the chat. So please let me know if you cannot access that or can't see that. But Hope is here just to help us with our TA support. So a lot of the questions that we're having, we'll definitely be asking our SAMHSA representative directly. And these are notes that I have, and they were going into the slide deck. So hopefully I'll be starting to get some answers around that. And we can ask our representative to come and speak at a meeting as well at a later date and time, to get some further questions answered. But just wanted to kind of talk a little bit about the TA proposal and what that's going to entail. It looks like Anna is going to be helping us a lot with different things such as, meeting organization flow, how to train us to help you all with the letters of recommendation, because as we're all kind of new to this and just figuring it out together. And so Anna's going to be here to help kind of just guide us and support us around things of that nature. So really excited to have Anne. If everybody would like to take a look at the TA plan and the link, and if you have any questions about that. And then Anne, if you wanted to speak to the proposal a little bit more.
I'd be happy to. First of all, let me tell you a little bit about it. So I am a technical assistance provider. I work for a company called Advocates for Human Potential. And I have had a lot of experience, personal experience. I sat on the Texas State Olmstead Committee for 6 years, which is not the Planning Council, but it's similar level of activity. And then I've provided technical assistance and support to planning councils all across the country. So does that mean I know I have all the answers at my fingertips? No, right? But I know where to look. And I know, Caitlin, that you have accessed the latest Mental Health Block Grant 101 handbook. And I would recommend that to everybody, just sort of as a reference point. I'm very impressed that your SAMHSA administrator is going to do a walkthrough for you. And so I think part of my purpose in being here is to sort of flesh out with the rest of you how I can help you. What's written in the plan is that what we typically do with planning councils is conduct interviews of key informants. So we do 4 to 6 interviews usually with people who have either a long history. Sometimes we talk to new people because we're curious about how new council members are onboarded. But the key informant list would be up to this group. So we're planning to do some interviews, again, to get a better sense of how we can help, where we can target our assistance. In talking to Caitlin, and we have sort of already identified that the block grant review is something that you are interested in, fine tuning, and that there are, there may be. I'm just so impressed you're already working on your bylaws. But there may be opportunities for us to help with suggestions for the bylaws, because bylaws really is it's the skeleton that everything else hangs on. And looking at how you use your committees, what your committees are, how do you use those committees, how do they roll up into an executive team. The highest functioning councils, I think, are ones that have active and effective committees. And so the block grant review committee, you might have a block grant review committee, and they would do the bulk of the nitty-gritty, review of a 200-page document, right? And then the block grant review committee would take questions and recommendations to the executive committee, and the executive committee would bring them to the council. So it's like that kind of operational structure are the kinds of things that councils often need. I don't know if you need that or not. We're looking at, we've proposed to do 2 different phases, and you may just need phase 1. We never know till we get into it. But phase 1 is sort of that exploratory and sort of preliminary sort of recommendations and the training. Right. So if we decided that what you needed was, guidance around managing difficult discussions, then we might provide that We might provide coaching to the leadership, and we might provide a training on group norms to the entire council. So we will do, assuming SAMHSA approves this, we will do a phase 1 exploratory, provide some training and some recommendations. Phase 2, if it occurs, is really going to be much more it's whatever emerges from phase 1 that we can help you with. The kinds of things that we've done and are doing now for one, I'm doing now for one state, is ongoing coaching of the leadership. That we've got, often you have people who are maybe accustomed to running a meeting in their work site, but sometimes working with a planning council, you have to be much more inclusive of discussion. And so some people need some help with that. We might help you develop an annual work plan if you don't already have one. That would be a phase 2 activity. And so that's our preliminary thinking on it. Where we are in the process is you have it in your hands. You're discussing it today. Once you've decided, you can tinker with it, send it back to us. Once you've decided that you approve of what we're proposing, then we submit it to SAMHSA. And then we have to wait for SAMHSA to approve. And sometimes that happens right away, and sometimes it takes a longer time. It's mysterious to me why, but that's where we're at. Questions? Let me ask you a question. So if there was one thing that you could get out of technical assistance that you think would make a difference for this council, what would that be?
I know for myself, a little bit of training and support around the block grant applications and the letter of recommendation around that. I know just sitting in and trying to facilitate and help the report subcommittee, it's been, I'm just as confused on certain things as they are. And so some clarity and some coaching around that would be just fantastic.
Okay. Anybody else?
I would, I've been on the council for a little while now, and I would love for us to have a really succinct annual plan for when we should work on what in the year. And then that gives us real structure around it. And even if, I know that sometimes we have people who are on this council, we have really busy people. And so if we know what we're working on each month, then even if someone can't attend, then they're able to give their input, and we're able to actually have their voice at the table, even if they're not able to be here and be present. And then I'd like a little bit more, I know we make our recommendations to the state, but my first round to doing that, I felt very ill prepared because I wasn't even sure what was appropriate to ask.
Okay.
So I have all these ideas that I would love to have done. And I looked at the previous year's plan, and I thought, and recommendations, and they weren't really adopted. And I thought, well, are we missing the mark? Are we not? So sometimes I'm like, okay, am I asking for the wrong things from the wrong people?
Right.
And I run a nonprofit myself, so I know that if I ask the wrong thing to the wrong grantor or the wrong funder, then of course I'm going to get a no. But so can we have a little guidance on who to ask for what, and so that we're more successful in competing for those dollars?
Okay. Yes, what I'm hearing you say is how to make those recommendations to the state more targeted and more effective. Got it.
Love that.
Hand up.
Dennis?
Yeah, and Caitlin knows me as a broken record on this, but I want to echo my approval of what Annette said. I'm a big believer in understanding the flow of things.
Okay.
And I'm always asking for a flow chart. What comes first? What comes next? What's at the end? And that would be on the process, soup to nuts, from you know, the initial request of the state application all the way through the awarding of funds. That would be real helpful for us to understand the mechanisms that are triggered in each phase.
Yeah, agreed. And also, let me ask you this. Are you reviewing data on those elements? So like if you had, for example, a first episode psychosis program, are you getting data reports? How many people have been served, you know, and outcome measures?
Actually, that's what we're banging hard on. We
Okay.
want that information. and we
Okay.
have not been have had access to it. We've been flying it blind in my
Okay.
view. So we're looking at numbers with no connection
No
to the
frame of reference.
reality of what it all means. So that's to me, that has to be a part of what we're doing if we're going to be an effective council.
Right.
And that's something that the state is wanting as well, and guidance on how to, you know, put that together, bring that context. And that's something that
Okay.
we're actively looking for support
Okay.
with this as well.
Yeah, so that kind of data support, I mean, I will say that the proper purview of the council is data related to how you're spending your money. For you know, because that's related to the block grant review. And then as you also, and I haven't been in this meeting long enough to hear it, but as you are also working on system level advocacy, you can request, the council can request data from the state about specific issues that the system level advocacy function is looking at. So one of the states that I'm working with right now, they're revamping their crisis system. And so the council has a legit right, you know, to ask, because they're working on system advocacy. They're out there working with the legislature, so they need data related to what's going on with crisis. But the monitoring, I guess I'm saying all that to say that the council's role around monitoring is not limited, but it's focused. It's focused on system advocacy that you're actually working on and things that are actually funded with the block grant. The other thing I want to say about the data, and then I'll stop talking about it, is that when you're looking at, like, say, my example about first episode psychosis, so you want to know what's being funded and what the performance is. How many people are they serving? Blah blah blah. Okay, but the state may not be able to share proprietary information, right? So you may or may not be able to, given your state structure. I mean, if it's already public record, it doesn't matter, but some states have been reluctant to give out, we funded these 4 providers and this is the amount they got and this is what they got it for. So the way those data then are presented to the council is sort of aggregated without identifying providers specifically. That might be a rabbit hole, sorry.
But Jan, that will probably be something that we'll need to review with Kasha and the data team, because I have no idea, to be 100% honest, like how that's structured, if there are disclosures, I have no idea. Andrea, if you have any idea off the top of your head, but that would definitely be something that we'll speak with.
Yeah, I hesitate to jump too much below surface level on data and like adjacent issues to that. Though we do have a number of resources that we can come back with questions as well and work
It's an
around that.
interaction. The council
Yes.
needs to be educated enough to ask smart and focused questions.
Yep.
And you have to be willing to give them that information or tell why you can't. It's a cooperative, it's a cooperative thing.
Definitely.
Because I've seen data misused. I've seen councils demand, and this is my favorite example, we want to know how many people were served with puppy sitting programs, right? There's no such thing, but and that has nothing to do with the block grant. It has nothing to do with system advocacy that people are working on, and it's out of your lane, right? I have also seen the opposite, which is the state dumps data on the council without a lot of interpretation, and it just overwhelms the council, and then it makes the council ineffective in the other direction. So we're
I
looking
think that's
for
where we're
that.
at.
Yeah.
We're throwing a
looking
lot of
towards
numbers
that.
and yeah, no context. And so, yeah, it's overwhelming. I mean, just
Yeah.
myself looking at the report, I'm like, what? Like,
What does that mean? Right.
right.
And yeah, I'm not in any, I don't know, you know, sometimes it's unintentional. I saw one example where I think they were doing it on purpose. We won't talk about that. Yeah.
Question around that specific process, right? What is the right balance? Like, how much is too much? I know that our council has been requesting data for some time now, and we still haven't really received the disaggregate data around those specifics in the blank grant, right? Like, how are you using those dollars? What are those dollars going for, right? It's important for us as a council to have that information so that we can really make those recommendations based off of the information that we have about what's currently happening with our block grant. So that we have made that request. So if that is a requirement that this council receives that data, where does that requirement live? Is that also in statute? If yes, I'd like the statutory requirement that the council must receive the data. And then I have a additional question around, so the council, and there's some sort of, you know, at least in my mind, misunderstanding around whether or not the council made a decision collectively to do this smaller subcommittee that's actually reviewing the information. So right now we have this subcommittee with 3 people on it, myself, Michael, and Dennis. Thank you, Michael and Dennis, for being the other 2 humans on the council that are doing this. But what makes me curious is that, you know, saying overwhelming the council, right? Now it's just 3 of us. And then we're bringing these recommendations back to the larger group, which doesn't feel like a process of consensus the way that SAMHSA intended it to be. So that's another question I'd love for you to bring back to the SAMHSA folks, right? Like, with this whole requirement of the 51% representation, and how does that translate when we look at 3 people whom are now decision making for the larger group, and I don't know that there was a consensus process in deciding that we just wanted this smaller committee to make those decisions on behalf of all of us. So while that's my interpretation of what's happening, what I know is in our smaller subcommittee, I hear the same questions asked that the larger group is asking around where's the data, how do we inform the process, what is the format that's going to work for SAMHSA, so that when we present this to you, we present it to you in a way that makes sense, right? So you understand what it is we're asking for, and then what we're doing with those dollars. And so I'm just curious how SAMHSA feels about breaking this larger council into this smaller group. And then also just this idea that too much data is overwhelming for us. I think that it's part of the Behavioral Health Administration's role, and they have this nice gal, Kasha, and she's helping us kind of figure that part out. So with Kasha being sort of our internal tech support, it really does feel like we can manage that data, because the data should be specific just to how those block grant dollars are being spent, right? Like, we all decided to be on this council because we want to do this work. So part of doing the work is having the data.
Yeah, totally agreed. I would say, though, that I hear your, let me make sure I understand the part of that is, you know, if you empower a committee to review the block grant and then make recommendations, that committee may not be sufficiently representative. Is that part of what you're saying? Yeah, I agree. I hear that and I understand it. I think the trick is, though, it is, I would say, SAMHSA is neutral on this. They don't care how you do it. 1. 2, the recommended practice, in my opinion, is to have committees, and you can look at how those committees are membership is, right? Make sure that that's okay with you. But empowering committees to do what I'll call the grunt work of, in the case of the block grant review, really understanding all the steps. When does the state set priorities? How do you influence that? How all of those pieces of a block grant review, the block grant committee would be up on top of all of those steps. And then as they needed larger input, the recommended structure is they bring those questions or concerns to an executive team puts it on the agenda, and then it's discussed as a larger group. It's an efficient way to do it. Otherwise, if you're operating as a committee of the whole on something as complex as a block grant, that's paralyzing also. So.
And Anne, that's actually exactly what we're doing. So at the last meeting, we proposed the idea of the subcommittee, and the council, because we asked if they wanted a subcommittee, and then B, if they wanted to use the membership subcommittee for this, or to create a new report subcommittee, and they had decided for the new report subcommittee. We let members volunteer, and then what we're doing with the subcommittee is it's actually Sharon, Dennis, Megan, and Michael are the members of our subcommittee. And then I'm just sitting there, trying to help facilitate and things of that nature. But as you can see on our agenda, we're bringing back updates from the report subcommittee to the council as a whole to try and get that feedback, that larger input. And we'll do that again at the August meeting as well. And then we'll finalize it during the August meeting. So we are trying to, use, and according to our state statutes, all of our councils are legally allowed to create subcommittees to work on the council, on behalf of the council. And so that's exactly what we're trying to do here. We're trying to get, a couple of people like really, really strong and understood, and then bring that information back to the council and seek that larger feedback. So I'm glad to hear that that's kind of what you're recommending as well, because we want to be fully transparent, but I always make the comment of trying to write a report with 30 people. I know when I was in school, trying to write a report with 5 people was hard enough. So trying to maintain transparency, keep that full feedback going, but help organized and just efficiency as well. Right. So I don't mean to cut anybody off. I just want to kind of look back at the agenda and see that we're a little bit behind schedule. And I also got a notification that our meeting's going to be ending soon. So if we get disconnected, please jump back on, because we're not done yet. And this will not happen again. I'm so sorry for everybody. So any last minute comments, questions, concerns for Anne before we continue throughout the agenda?
And if it's okay with you, I may just stay on and watch y'all.
Absolutely.
That's a way for me to get sort of immersed in what you're doing.
Absolutely. You're more than welcome to join every meeting you want. I'll send you the report. I'll send you the meeting. Whatever you want to do, Anne, you're more than welcome.
Okay.
All right, Megan, I'm going to hand it back over to you to move us forward.
All right, so it looks like we're getting into our bylaws, and I know those were emailed to everybody, and so just opening up the floor for discussion around that, and any clarification from you, Caitlin, around the bylaws process and where we're at in that process.
Sounds good. So Dennis, I'm going to try and answer your question. If it's the question about the numbers, I'm going to address that first. Let me know if you have another one then. So specifically around, I'm going to be pulling up the bylaws, and so under Article 2, membership, for statute requirements, Section 1, statute requirements, is taken directly from the language of statute. So I'm going to drop in the link. If you just look up this statute online, you'll be able to see all the language around it. I'm just pulling up the first one I saw, which is Cornell Law School. But basically, so that's not the one I wanted. So not less than 50% is language of statute. So that's what we wanted to add in there. So that means that 51% of this council is not going to be state entities. It's going to be, lived experience, families of persons with mental illness. So that's where we got that language from specifically. Now, when it comes to membership appointment, number 2 under Article 2, the 10 members versus the 25 members. So in order for how we got the number of 10 members, because in statute, there is not a minimum or a maximum like we have for the other councils. So for the minimum requirement, that is the number that we had to ensure in order for participation, to make sure that no state agency is going to be basically the 51%. We're ensuring that 51% with that minimum of that 10%. Now we capped this at 25 members because we are working on a compensation proposal. So unfortunately, us being a newer state agency, we don't have unlimited funding. We are, again, doing a compensation proposal, which we have mentioned at the bottom of the bylaws. We are in our process of taking that to the fiscal team and everything right now. And so in order to ensure a proper compensation for each meeting and subcommittees and that level, that's the maximum number that we could basically submit for our compensation proposal. This is still the largest council that we have within BHA. And so that is kind of where we got those numbers from. Obviously, we want your feedback, and please submit that through the feedback form. But that's kind of where those numbers originated from. So any questions, comments, concerns about that? Yes.
Unmute. What I'd like to see happen, first of all, is to form a subcommittee of us to review this, because I mean, there's a number of things missing in it, particularly on the committee side, that I'd like to see added, and other issues. But how we can put together bylaws without representation of the council itself is kind of not productive. What I'd like to see, and I'm recommending that we form a subcommittee. We have the chair, vice chair. I could represent membership, and then any other council member that wants to be part of the process. We can put together a more relevant bylaws and then have it presented and voted on by the entire council with more input if necessary. But again, we want it to be effective and relevant to what we're doing.
Absolutely. And that's why we're taking
that's my recommendation.
Yeah, absolutely.
And request at the same time, and I'll be more than happy to work.
I'm all about these subcommittees. You know me. I'm here. I'm open to you guys. I want to work with you. Again, and this is just the first draft. This is nothing set in stone. We want your feedback. We want this to be tailored specifically to the needs of this council. Certain things in here just kind of have to stay, and that's just statute language, basically. Obviously, certain things from what BHA can do specifically, and with regards to our AG, we'll need to run through our AG as well, just to make sure that legally BHA can do things that you guys are going to be asking of BHA. So yeah, I'm all about, if you guys if we want to vote for a subcommittee, I'm happy to do that. We can start working through this together. I want the feedback, and we want to start incorporating that. So yeah, let's do what you guys want to do about this. Megan?
So I have a question because I know that the BHA is standardizing the bylaws across the councils that they oversee. So if we have this awesome committee and we do these